I'm Jonathan Steinberger. I'm an interventional radiologist, co-founder of Doc's Interventional Medicine. Our specialty is a little bit different from most other specialties because most specialties focus on one particular part of the body, one particular set of diseases. We treat things from cancer all the way to knee pain, but instead of really focusing on just one disease area, what we focus on is a set of techniques that are cutting edge, extremely minimally invasive to the max, we like to say, because it's all done through tiny little needle pokes. By doing that, we are able to treat these conditions and get results that are comparable to surgery in a lot of cases, but with much easier recovery times, much lower complication rates, a much easier experience for the patient. And so we're excited to bring these set of techniques and different treatment options to patients. PAE, or prostate artery embolization, is a wonderful technique to treat benign prostatic hypertrophy or enlargement of the prostate. What PAE offers is a treatment that is completely non-disruptive to the urinary tract, doesn't require a urinary catheter during or after the procedure, and we go through the blood vessels. And so instead of really treating and trying to resect the tissue or cut it away like a surgeon does, what we do is we go in through the blood vessels and we inject special little beads or particles that block the blood supply to the prostate. So it's a very different approach to the problem. It starves the prostate of its blood supply. When that prostate gets starved of its blood supply, it starts to shrink down and it starts to soften up. And the way that the prostate enlargement affects all those symptoms is that it compresses the urethra where it comes out of the bladder. So by shrinking it down and softening it up, that obstruction, that blockage opens up, the passage opens up, and patients have a lot easier time going to the bathroom, emptying completely, their stream gets stronger, and they find that they're getting up fewer times in the night. Their whole quality of life improves.
Regarding PAE, who is the ideal candidate for this kind of procedure?
The ideal candidate for this procedure, it's pretty broad. So obviously it's patients who have this condition of prostate enlargement, but it can be patients who have significant symptoms but want to avoid more invasive surgical procedures. It might be patients who cannot get a more invasive surgical procedure. Some patients have prostates that are so big that it's actually unsafe or difficult to get the surgical procedure, but we're still able to treat them using our techniques. Some patients are not tolerating or don't want to be on prostate medications because the first line of therapy typically for this problem is actually a series of medications, but those medications have side effects. And we actually have good data showing that even compared to those medications, the safety profile of doing this procedure is highly favorable. There are very few patients who don't qualify for this procedure based on their kidney function or the disease in their blood vessels, but most patients find that it's a really attractive option for them when they're trying to pick the right therapy.
Briefly, how do you ensure patient comfort and safety during this treatment?
Patient comfort and safety is the number one priority when we're doing the procedure, and we have a dedicated team member whose entire focus during the case, their only job is to make sure that our patients are comfortable and that they're being monitored and that they're safe throughout the procedure. Our procedures are also not painful, and some patients elect actually to do these procedures under just local anesthesia, and patients are sometimes awake and experiencing the procedure and watching it along with us and actually talking to us throughout. And it's all fine, whether they want to be more awake or more asleep, we can accommodate that.
What are some of the key benefits of choosing minimally invasive approach?
What we do as interventional radiologists is provide new techniques for doing things that were typically done with invasive surgeries in the past, with much lower complication rates and a much easier experience for patients, easier recovery and easier procedural experience.
What can the patient expect immediately following the procedure?
So immediately following prostate artery embolization, you'll go to our recovery area. You'll be there for just a little while. You'll be flat for a little bit with your legs straight, and then We'll get patients up and walking even in our recovery area. You might feel a little bit of soreness at the site where we access the vessels. Typically we do that in the upper thigh or groin area, but then you should be good to be up and walking pretty soon thereafter. About a day afterwards, you might notice that your symptoms get a little bit stronger for a few days. So actually things get potentially a little bit worse just for a few days. More frequency, urgency, a little bit of pain or burning with urination. We actually give you a whole slew of medications to help mitigate that. So most patients are able to get through that period of time with just a little bit of discomfort. By about a week out, most patients are feeling back to normal, and then they'll start to notice that their symptoms improve over the coming weeks and months. It's about a week of recovery, but really you're kind of back to your normal level of function within a day or so.